Hey everybody, it's Lashay and welcome back to But I Did It. Today I am here with Dr. Rhee and I'm so excited to have him on as a guest. He wanted to talk about healing and recovery in the medicine field. And so everybody, this is Dr. Rhee.
Hey everybody, how you doing? Lashay, thank you very much for this great opportunity to talk to you and your people.
Yes, and so um, my last episode, or a few of my last episodes, I've been focusing really on healing and moving forward in a journey that you're on. Finding yourself in a place where you're kind of not necessarily rock bottom, but you're low. You're at this point where it's like, I really want to be able to figure out how do I pick myself up from here and go forward. And from what you were telling me, you actually work with a lot of athletes and different people that have found themselves in this situation before. And your focus is on helping them to come out of that place and overcome into something new, right? Am I?
Yeah, so I guess my background starts with I'm a sports chiropractor, and I've taken myself all the way from the days of working at UCLA, and then of course they graduate and they go to the pro world or Olympics, and then you follow them along and you see their protocols for the recovery. And like anything else, when you really push yourself, you have to have the time to recover from that push, right? So when you work out really hard, the object is that you have to recover and have some rest so you can build bigger, better, stronger muscles. And then you're able to go to the next push or the next event or game. So these kids would like graduate and they go to the pro world, and you see their protocols for that kind of level of sports to recover. If it's like maybe like whole body cryotherapy or some other like some devices out there that includes stem cell therapy. So I see the evolutions occur from where it was to where it's moving towards to. So it's about really advancing someone's recovery from either a workout, a game, or an injury. So that's the biggest thing. So that's the secret out there. They're trying to get that kind of like that formulation down so they can perfect their world. So when they advance more into their professional world, they can get that money they say, right?
Okay. And you're looking more, like you said, at building that muscle memory and getting away from just the over-the-counter medicine or prescriptions, but looking at your body healing itself. Because honestly, we were built for that. We have, we're made to be able to heal in a way that we don't always have to look for medications. But I think that's something that society has kind of made so much of the norm. And so what you're saying is you really want to get back away from that, of taking that normalcy and saying, no, if we focus more on, what our bodies are naturally able to do and put it into work, then this is what the athletes need now. Am I?
So it's not just the athletes; it's everybody else. So as we have the cells to regenerate and to rebuild and to really like get ourselves recovered, to get back into either a good workout or even just simple activity like a
Okay.
walk or playing like some kind of like that. What's that, pickleball or something like that? You're gonna get sore. So we have the cells to regenerate. The problem is that those cells are kind of dormant. They call it senescence or zombie-like. They don't do anything. They just sit there, but they're waiting for something. So you have to introduce them with a signal. We had that signal in our body, but as we age, those signals start decreasing. So now we have to introduce with a brighter, stronger signaler from stem cell therapy. So once you get the signal in there, now all of a sudden those tissues will regenerate and wake up and start regenerating. So you heal faster. So we have that whole, everything that we need in our bodies there. We just have to figure out how to unlock that little secret to open it up and get it. And that's what the stem cell is. And that's why this is very important for the future. How we can, each of us can have this type of like secret weapon and turn on a signal.
Yes, I love that. I love that. And I'm so glad that you're passionate about this, like taking that and spreading that information, that knowledge, because it's not known. Like you said, not just for the athletes. I'm like the athletes, but right for everybody, because we get to a place, especially as we age and we get into our normal routines of life, we work and our bodies get used to kind of being stagnant. And so waking those cells up and getting ourselves back into those routines, it's not always easy. But I think you're on such a great journey and a path of just sharing that knowledge and spreading that. And I believe you said that you also have a book about this, and you were, can you tell me the title of that again, and
Yeah.
then share that with our listeners?
Yeah. So the big thing with like stem cell therapy is to explain it. So then I would have to repeat myself over and over again. So I got lazy. So I said, let me write a book to like kind of like here, read my book and then come back and ask those questions. So then the book is called The Future of Regenerative Medicine: Unlocking the Potential of Topical Stem Cell Therapy. So it's a long title, but the thing is that I look at that title and goes, I should just call it the book, something real simple, right? Hey, but the book was written for two readers. One reader was a science based, the one that likes to see those kind of like those signalers, those interleukins or those types of microRNAs. They want to see those type of messages. And then there's another version of it inside the book where you can follow Jeff's journey and takes it down to layman's kind of terminology where you can just hear it, where it's simpler formatting to understand what stem cells, like where it started, where it's going to, and then the different kind of stem cells. So it talks to all the readers out there.
Okay, that's great. I have not got my copy yet, but I am definitely planning on it. And I'm really excited to hear that you kind of, bring it down to terms for people like me. I'm not a science person. I don't know a lot about stem cells, but to be able to know that this is something I will still be able to read and understand, I'm liking that already, and so I'm excited. I am definitely going to link that in the show notes for everyone else. You can get you a copy of it as well. Um, is there anything else you kind of want to share with me, share with our listeners? Um,
Oh yeah, I guess we can. Stem cell therapy by itself is interesting because everybody hears the word stem cell and they think like, okay, so it's coming from like some type of tissue, like either like there's different kinds of stem cells, right? So there's all the types that the people think like it could be from like a baby, and then you think about could it be by your own tissue? So it comes from a lot of places. There's the embryonic stem cell, and there's all these other things. But the thing is that you have to understand is that it's not so much the stem cell. They call it the live stem cells. They're typically injected into your body.
mhm.
So when you think that, you're thinking about, well, why is it that these cells can somehow differentiate or turn into our existing tissue? It's almost impossible to do that. What it really does, because you think about how does it take that chromosome that's from somewhere else, from like the umbilical cord or the baby or something, and how does it know to turn into your tissue, which has their own chromosome,
Right.
right? And those chromosomes have millions of codes. And then how is it going to know match up perfectly? It's impossible. So really, stem cell is not about the cell itself. It's the stuff that secretes out of the cell they call them extracellular vesicles, EVs. These are the
Right.
signals. The signals are what tells your own tissue to say, turn on, wake up, and regenerate. So there's a kind of like a misunderstanding about stem cells when it comes to like what does it
hmm
do. So you're going to see the new science coming out where they really talk about how this whole process, this mechanism of stem cell regeneration occurs. It's going to talk about turning on your own existing tissues and regenerate. It's not this other tissue from another person or your other part of your body coming in there and doing it. It's almost impossible. What it's going to do is going to signal. It's almost like almost think about the analogy I would use is that as I'm an old guy, right? I'm in the 50s, 57. So
You look great.
yeah, hey, this is I like compliments, so I tell people I'm 75 because wow,
Right?
you look great. Goes,
I'm like,
yes, right. I look really good now.
really?
So then, the analogy I use is like you have a dog that's in like maybe like 7 or 8 years old, but then you put a puppy near that older dog, and that's where the stem cell, and that's a signal, and all of a sudden it signals from the younger dog to the older dog, hey, I want to play, and then the older dog gets rambunctious and starts playing with the puppy.
Okay.
So it's that kind of like same analogy. You want a young tissue to wake your own tissue up, and say, do your job. So that's what stem cells all about. It's a signaling. They call it the paracrine effect, the cell-to-cell communication. And the most important thing, these cells that are signalers, they're what they call cell-free. So there's no nucleus, no DNA. So there's no chance of tumor formation. So there's big points that we have to acknowledge. No tumor formation because of these signals are just signaling your existing tissue to do something. And the biggest thing is that, that the world is going into with the regenerative medicine is a topical application. And that's where you just basically just rub it on your skin, and it absorbs through the skin into the damaged tissue, and it regenerates. So no more injections, no more high costs, no more invasive procedures or risk factors like getting cancer, infections and stuff like that. So there's really great points that are coming into the future that's going to be in the patient's hands.
Yeah, this is great. This is great. And I mean, especially like you said, just limiting the risk of infections and even for some people that are just, they have the phobia of injections and things like that. So this is something that will still be great for them. So they're not afraid to get the help that they need. And they don't have that, that block up to say, oh, well, I don't want to try this medication or that. Where this is something where it can be really simplified for them. Can you tell me how did you get into this? Because I'm hearing stem cells, and again, I'm kind of like, I'm thinking of like what you said, injections and science labs and, all of the big things like that. But you're like, no, this is something that is so much simpler than what people take and imagine. How did you get into this?
Okay, so it all started with my athletes. In my world, in the sports chiropractor, we're non-invasive. We don't do injections, prescription drugs. We're all about prehab or pre-injury exercises, or just preparing ourselves before we get injured by allowing the body to be in its best type of overall function, so that when they do a sport, they have the best chance of not being injured. So with these athletes, what you notice is that, especially my NFL guys, is that they all do stem cell therapy, the injections. So when they do the injections, they can't do it during the season, because when you do an injection during the season, there's a downtime. And they can't afford to have downtime. If they have downtime, it affects their contract, their money, and then, they would rather play the game under pain medication than to actually play, and then shut themselves down for the recovery from their stem cell therapy. So a lot of my athletes complained about that. So there was a void in that world of stem cell therapy during a season. Mm-hmm. So as I started listening to these guys, I started thinking, all right, how can I develop this? So I developed it with some other partners in the world of laboratory, R&D, played around with it, and we found out that there are components that does that transdermal component that goes through the skin, and it carries these little signals through the skin. Then we started looking at how do we protect it. We have to protect it with a thing called lipid nanoparticle. It's just a protecting kind of shell that goes outside these little signals, so it keeps up longer shelf life. So then we started looking at that and goes, all right, now we've got it. Then coincidentally, as this thing is at the last steps of like marketing, one of the NFL guys got hurt. And then the worst thing about it, he's entering the camp, the pre-camp, right before the season. Now, his last year contract, he's concerned that if you go and report an injury, you're going to be basically kind of like, how would you say, like red flag. So when you do renegotiate your contract, they say, well, you're prone to this kind of injury. So he didn't want to report it. So he took, my product called Regen, and then he applied it on his Achilles where his injury was at. Yeah, so the neat thing with him is that it was pretty bad in its injury site, right behind the heel. You hear about the Achilles tendon always being ruptured nowadays because the players are faster and the field is harder. So because of those two factors, you're seeing a lot of more incidents of these things, ruptures or some type of ACL injuries. There's a lot of things coming up now. So with this NFL guy, he applied it on his Achilles, and he really helped me tune it up by saying, it's too hot, it's not that good. So he helped me formulate the final steps. Now with that, he lasted the whole season without, having other injuries with that Achilles, and more importantly, he didn't report it to the team doctors. So then his negotiation was so much better because there was no negotiation factor of that injury site. So after I found out that it works on that high level athlete, then I said, let me take it away from these athletes and put it down in the civilian world and apply it to people that have osteoarthritis, tendinopathies, like elbow pains, knee pains, anything that has to regenerate tissue to heal faster works fantastic. So now this is the world we're in now. So now it's like not in the doctor's hand, it's in the patient's
Right.
hand. So now the patients can watch things like these podcasts and get educated, and they say, okay, I want that. So then they basically go and get that topical transdermal, cream called Regen.
So where can I find this now? Where are you? Is this available now? Your Regen.
So Regen right now is available. You can contact us and we can show you the fastest or the closest provider you have, and then you can get it from your provider. And then the providers, just ask them and they can distribute to you as a patient.
That's great. So it's already available. It's already been, like you said, tested. You know that it works. It's great. Um, so I want to ask too, like the process of this, of going through, because this is like your baby, right? You kind of had this idea, you took it, you got some partners together and started to really put the work into it, and then now you're at the end of it, full circle. How long was that, and like what was that process like, going through that whole process of really from beginning? Okay, this is actually going to be something, and oh no, it is something.
Yeah, I guess like when I say partners, I don't mean like partners like I had like partners in business. It's just people like how would you say you basically just you talk to scientists, and you get an advisory committee, and you kind of like work together, and so I wouldn't say partnership. It's
Okay.
more like they assisted me. So now, as long as how long it took, I mean, you thinking about, oh boy, I mean, I started thinking about this back probably in 2001, 2001, and then as it evolved, then you go into R&D, mixing, formulation, 2002, 2022, 23, and then you do a little test run here. We did an 80 patient test, they call it a pilot
Mm-hmm.
study, and we just talked about low back pain with osteoarthritis. So then we say, all right, if you have that, would you like to take this little, this test and this little like sample and try it out and see if it improves your pain? So we tested them, before the actual application of Regen, and then afterwards, and we had a pain reduction of 51%. So that shows great promise with the pain reduction. Then we looked at functionality of the actual tissue, and then we're moving into that world where we're doing like clinical trials. So the tough thing is that when you're on your own, it costs a lot of money. So you can only self-fund so much. So I'm doing my best, I'm out there working, I'm cutting yards, I'm doing all I can to get.
You got a dream, you gotta fund it. That's what it is.
Absolutely, that's one thing that I tell everybody. Moving away from like Regen and my
Mhm.
book, I like to talk to some of your listeners about what it takes to to follow your dream or pursue what you want.
Yes.
The hardest thing is that the hardest step is the first step, because it's like the commitment.
Yes.
And then the second part is to be consistently motivating yourself and going. Like, I feel anything is easy to start,
Hmm.
which is sometimes difficult for other people, but starting is easy. It's the consistency. Just keep driving.
Exactly.
Even though you have those little bit of ups, a lot of downs, you keep pushing. You keep pushing. And, lo and behold, you get something that has some momentum, and then, God willing, it just keeps going.
Right.
So,
Yeah, and I love that you brought that up, because that's main, one of that main aspects that I really want my listeners to understand. That's why I kind of wanted to ask about that process and the longevity of, you actually sticking with it. It You said 2001, like, to start from there into where you are now, you always had a vision. You had a plan when you started, and it may not look exactly like it is, like how you visioned, on that very first step, but you knew where you wanted to go. Your goal was always there. And like you said, that consistency is so important. Sometimes you get into the flow, you start and you're going, and you have a down, you come back up, you have a down, you come back up. But some downs, you're down longer than you would want to be or you expect to be, and that's where people start to give up. It's like, oh, this isn't going to work. I don't see it coming to pass. But you have to keep that consistency regardless of what it's looking like on the outside, and that's how you get to your goal. And so I love that you shared that, because regardless of the time that it takes, when you really set your mind to something, you say, this is what I want, this is what I'm going to do, you will get there as long as you continue to, chip at it. Sometimes it's just that little chip, like you said, just a little chip by chip, but every day you're keeping that in your forefront, and I know, like you said, working over this through years, I'm pretty sure there were days where you weren't able to actually touch regen. It's like, okay, I'm thinking about it, but I can't get to it today. There's nothing I can do to, move that process forward today, but it's still there. That vision is still there. I'm not losing it. I'm going to get there. And to be here at this point where it's like you're telling people about it, it's available for people to have. It's like you said, it actually, it works. You've seen the results of it, and so it's just great. I love this. I thank you so much for coming and sharing, just your whole story with me today, but also
Um,
putting this out there for other the medicine, that part of it as well.
if I can add more, that was beautifully said. If I can add more, I think the biggest thing that really drives me are like the military trained me. Like I was in the Navy, so it really trained me not to do something which is commonly done when I was younger, which is quit. It taught me don't quit, because what I learned was that if you don't quit, you never lose. That's the thing that people don't understand. You can always be winning if you don't quit. All you're telling people is, I'm still working out, I'm still progressing, I'm still moving forward. If you quit, you're not in the game anymore. So that's the biggest thing. And I'll be honest with you, the biggest strength I get, it's I have a faith. I have a faith that
Yes.
I take. You have, there's something that you have to understand, that there are times that you are down, alone, and you have to depend on somebody.
Hmm.
You better look. You better look. You better look for that special somebody. Mine was my faith.
Yes.
God.
Yes.
So that's big with me. So I always say that it's difficult by yourself. You better get a team, and if you don't have Almighty on your team, then you're gonna be you're not gonna have a good time. So that's my two things. So if your listeners can understand that and just find that dream and hold on to it tight as you can. There are things out there that are trying to take it away from you. You stay focused and always live in the future. If you're gonna live in the future, all your decisions are easy, because then it's like, should I do that? It goes, no, because my future says that, no, because I'm going to be over here. So those are the things that I keep true to me right there.
And that's something I'm actually learning now, is that living in the future. I was very big on present, present, present. I want to be present. I want to be present, which, don't get me wrong, is good. You do, of course, want to be in a present moment and enjoy, those moments that you won't be able to get back. But there is something magical about being in the future, about seeing yourself where you want to be, knowing that you're already there, that it's going to happen as long as you continue to reach for it and continue to keep that vision in mind. And sometimes I think that's where some people lack. I'll say for myself, that's where I was lacking. I couldn't see myself where I wanted to be. I had the thought, I even started, but then I didn't have that vision of saying, where am I in the future? And so recently, that's what I've been doing. I see myself as, this successful podcaster. I see myself as someone that is just advocating for mental health, for natural healing, all of these things. And it's great, because before I had that vision, it was just really kind of like just spinning my wheels. Like I was moving, but I wasn't necessarily going anywhere because I couldn't see where I wanted to actually be. And so I love that you say that, seeing yourself in the future and knowing where you actually want to be. And that's constantly changing, I feel like, because when you reach one goal, then you continue to go. You say, okay, I'm here. Now, where do I see myself past here? And so I think it's really important to set those, like, where do you see yourself in 5 years? Where do you see yourself in 10 years? I think those things that we used to get, taking it back to like school age, and we're both, past school age or however, but
I'm way past that
I
there.
feel like it's important to stay in that kind of childlike thought frame, because we get to a point where we stop asking ourselves those kind of questions and we stop seeing that for ourselves. And so you have to keep that Yeah, you have to keep that vision.
Yeah. But I think you said it, there was another key point you just said about that child in you. Remember when we were kids, we used to dream a lot. You
Yes.
remember? And then I remember my dad says, "Stop dreaming. Stop." Here's something that's in me. I dream. When I dream big.
Mm-hmm.
And then for some reason, I've got this mechanism that I forget the past. In the present, I'm not there. I'm always in the future. So when I dream, I'm already
Right.
there. I'm just finding a way to get there faster with steps and maneuvers and education. So yeah, you're look. I learned that the military beat me up enough to say, hey, this is how you got to do it. So you're learning a different pattern. I learned in my pattern. But the neat thing about that is we're always learning. We're always growing
Exactly.
up, and we're always advancing, developing, and regenerating.
Yes.
Right?
Yes.
So, so, so the beautiful thing is that your listeners are going to take this information and then apply it, and then it's once you understand that the future is where you want to live at right now. The present has nothing. It's almost like this. It's almost like driving the car and looking down at the ground as you're passing
Yeah.
it. You don't know where you're going.
Exactly.
Look ahead
Exactly.
and see the destination. Hit the GPS, hit Google, ask Google, hey, where am I going? And then go.
Yeah. I love that analogy. I like that. I think I'm going to use that. Definitely. I want to be able to take that and use that and share that. You have to look up, because we get so caught up with where we are. And I think a few years back, it was really big, like grind culture. Like everybody wanted to grind, grind, grind. And it's like, there's nothing wrong with that. But then you get into this, rhythm of where you're just constantly beating the pavement, but you never took the time to kind of look up and see where you're going. Where are you going? What's your goals? What's your vision? Where do you actually want to end up instead of just, beating that pavement? And so, yes, I love that you bring that up. I like that analogy as well. I'm looking at your name in the back, regen, and then kind of connecting the dots here. Sometimes I can take a minute, but Dr. Rhee. So, how did you? What gave you the idea to incorporate your name into your
Okay, so
the name of your product, your
uh,
your
the,
medicine?
the so yeah, so regen. So here's the thing. So it's always been like almost like a simple letters that people will apply on like rehab, regenerate, and then it started that way in a sense that it just easily flow off the tongue, and then when we started going into like stem cell therapy and regen, I started looking at it like, regen, 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 and finally it knocked. Oh, it's like a that cartoon when you see a light
Yeah.
bulb above your head and ding, it pops up. I said, wait a minute, my name, regenerate. What am I doing here? So then I just stuck it together like that. So it's like I wish it was a better story, but it was just standing there like just
Like
thinking,
a light bulb moment.
that's fun. Yeah, it was exactly. I was sitting there, and goes, wait a minute, holy, those little two synaptic nerves in my
Yeah.
brain finally connected. Goes, wait a minute, I get it now. So
And that's perfect
so
though.
that's where it's that yeah.
And like my faith as well, my faith. And so I feel like sometimes, we're given these little the way I want to say like help notes, little like you call it a light bulb, but I feel like to me it's like our higher power kind of speaking to us and saying you're on the right track, you're on the right track. And so for that to just come together like that in that perfect moment, it's like, this is what I'm doing. This is what I've been doing the whole time. It's been here. I've always had. It already existed. It just took for me to believe in it, and here it is. You know.
Yeah, there, look, a person of faith. There's one thing that I keep a secret, and I'll spread it to you guys. But I'll be honest with you, there are signals from your messenger that's telling you things, and if you're not ready to listen to it, you won't listen to it. But if you really open up your heart, you'll see it. They're everywhere. Signals everywhere. Like, look at that, look at that. And even in your downest time,
Hmm.
you think you're down there, there's other things. They'll show signs of why that God put you there.
Exactly.
There is humbling experiences. There are reasons why you need this, and I always say, I look forward to those real negative down points because I know that if you perceive yourself as that future person, you push right through and it comes right back up. It will. It will. You just keep your faith, keep driving forward, and then more importantly, just never quit.
Quit. Never quit. Yes, I love that. Thank you so much, Dr. Rhee. This has been great. Really hit on a lot of great key points: consistency, believing in yourself, powering through, having that vision and dream, stand with a childlike mentality. Just thank you. This was a really good, really good. And so
Oh, awesome! I love it. Thank you.
um, uh, any last words you would like to say with our listeners? And I will definitely be sure to link your book in our show notes as well.
Okay. I guess the biggest thing I want to tell your listeners is that people told me don't do it. People say don't do this, don't do that, don't become that. I'm not that person. I love to be outside. I'm that 1% that says no, you can do it. When people say, "Hey, don't do this," I said, "But I did it." You
That's
just gotta
right,
do it.
but I did it.
But I did it. That's how it is. You have to be that special person that believes in yourself, but live in the future, and don't listen to nobody. I, you know, there's. I think I forgot who said that, but there are a point where you're gonna be without your friends, and then you're gonna be where the friends you want are not gonna accept you. So you're stuck in this little world of loneliness, but it's just a transition. So there's going to be times where everybody feels like they're against you. There's going to be times where you're going to feel different, and there's going to be times where you feel like nothing's working out for you. Just hang in there, and then at the end you'll say, "But I did it."
I know I said last notes, but actually I one more support system, because you kind of brought that up right now as far as like what your friends are going to look like here and there, just in that point of being, that loneliness, but you always have your faith. What did that look like for you in your journey, that support system, and how did you get through those moments of where it was? I know, like you mentioned your faith, but if you could kind of go a little bit deeper into how did you get through those moments where it was really just you were your only fan.
Okay, so there, I think the lowest point that I had was a lot of like factors. It was awful in the sense that you can't get any lower than how. There's probably people that can get lower, but I remember when my mom passed away. Then the same week my sister passes away. So then the next week I broke my foot. So now my business is going bad. So then my other business is going bad. So I'm getting all the stressors on me. It's just like it's starting to come on me, and I feel the weight. Just like everybody feels stress, they feel that weight. So my broken foot, I'm on crutches and I'm walking, and then I'm just like just I wouldn't say like feeling sorry for myself, but I'm just like wondering what's going on. Then I slip. There's a set of stairs, and the bottom of the stairs is like I can see it, but it's dog urine. I slip on it and I fall, and now I'm laying on my back with dog urine, and then I just sit there and I'm like, do I belong here? And I just sat there and I just accepted it. It goes, this is where I am.
Yeah.
And then for some reason, I don't know what happened, but 10 minutes, something happened. Goes, get up. It's time to get
Time
up.
to get up.
Now, is it me and my inner thoughts? Is it God? I'll accept it all because that's what drove me. Because I was like, this is the bottom. This is where I belong.
Right.
And all of a sudden, I just heard it. Get up. And you get up and you say, all right, one step at a time, hop up the steps. And all of a sudden, it was like, that was a start. It's a new benchmark. It's a new starting
Yes.
point. And now it's time to build on. So I guess that's the biggest thing that my group of like dependable people is me and God. That's my dependable. I have friends, but you know what happens when you depend on people too much, they'll let you
Exactly.
down. You know that God's never going to let you down, and yourself's never going to let you down. So those two things are the best team that you can have at the starting point. You'll build your team, you will, and then you'll get a little bit of restrictions, but those are the two people that I really keep deep in my soul.
Yes. Thank you. Thank you for sharing that. Yes. I hope everybody listening pulled some type of uplift from this. You know, wherever you're at, if you're at your rock bottom, you're in that low point, you're down. Tell yourself, sometimes you have to be the one to tell yourself, or listen for his voice, because like I said, he's always there. Get up. It's time to get up. Thank you so much, Dr. Rhee.
That's awesome. Thank you very much for this opportunity. I really appreciate this. This is fun.
This was. All right. You have a good, thank you.
Thank you very much and have a great day.